Welcome to our case report on open inferior vena cava filter removals, and greetings from Jackson, Mississippi. Our authors have no disclosures. In the modern age of endovascular therapy, there have been dramatic changes in recommendations regarding the placement of inferior vena cava filters and the timing of their removal. Commonly, these filters that cannot be easily removed via endovascular techniques are left in place indefinitely, possibly up to years. Historically, open filter removal has been reserved for those filters causing complications or symptoms regarding adjacent structures. We performed a retrospective review of open inferior vena cava filter removals performed at our single institution from 2011 to the middle of 2019. We performed 9 such procedures. 6 of our patients were female with a mean age of 46. This included the young trauma population up to patients in their 60s. The mean time in place was about 6.5 years. Regarding indications for placement, the majority of these filters were placed for deep venous thrombosis and pulmonary embolisms in patients who otherwise could not tolerate anticoagulation. A third of these patients were high-risk traumas who could not be anticoagulated because of other injuries. Filter malposition and erosion through the IVC wall was the most common indication for removal. A third of our patients were experiencing chronic back pain thought to be secondary to erosion into the nearby vertebral body, and 2 of these filters were removed for erosion into the duodenum. Here you can see non-contrasted CT images of an IVC filter eroding into the nearby aorta and adjacent vertebral body. Our mean length of hospital stay was post-operative day 6. There was 1 patient who experienced a postoperative ileus which resolved without further intervention. There were 2 wound infections, 1 which required a second operation. Most of these filters were able to be removed through a small venotomy after full mobilization of the inferior vena cava. 2 of the patients required extensive venotomies for filter retrieval. In patients who are experiencing chronic back pain, only 1 of our 3 patients experienced symptom improvement after their filter was removed. In conclusion, open inferior vena cava filter removal can be a safe operation in patients who have otherwise failed endovascular methods for removal. These filters can usually be removed through IVC mobilization and a small venotomy. And in patients with chronic back pain secondary to erosion into the vertebral bodies, the majority of these patients will not experience improvement of their symptoms. Thank you for your time, and we appreciate the opportunity to participate in this year's virtual program.